is Jang. I'm an associate professor of Hansa University of South Korea and very glad to present to you. Today, I'd like to talk to you about a study on subjectivity toward death of overwork nursing students. This is introduction. Karoshi is an internationally recognized term that was first used in Japan, which described death of overwork. This is a social term, not a medically defined term, as a term referring to death due to long working hours and heavy workload. And to define this medically, it is case of sudden death due to a disease that has a causal relationship between overwork and a disease, or a case of worsening after onset of the disease. And it can be defined as a case in which overwork on the job preceded by time is recognized. Nurses not only occupy the highest portion of health treatment field, but are also key personnel who had most care with the subject and in the rapidly changing healthcare environment, safe and high quality nursing needed to be provided to the subject within limited time. The subjectivity of cognition when caring with subjects in the nursing has a large influence on the nursing day practice. There are no studies on death or overwork regarding students of nursing. Therefore, the Q methodology is a method that allows understanding of characteristics of each type following to the structure of person's subjectivity and begin from the perspectives of the actor rather than the assumption of the researcher. And since the recognition of death or of overwork of nursing students is a subjective and unique experience, it is a proper research method to confirm the type of recognition of death of overwork of nursing students by the Q methodology, which is a research method that considers subjectivity. Therefore, this study aimed to understand the subjectivity structure of death of overwork from the perspectives of nursing students who are prospective nurses before entering the nursing field, where nursing care for death of overwork occurs. And it is aimed to supply the basic data to develop a differentiated educational program according to the characteristics of each type of recognition of death of overwork. The aim of this study is to examine the type and characteristics of subjective perceptions of death of overwork of nursing students by using Q methodology, and it is intended to provide basic data for providing information on nursing students dealing with death of overwork patients and suggest strategies for nursing education. The specific research objectives for this are as follows: clarify the subjective perception of the death of overwork in nursing students, analyze and describes characteristics of perception patterns on death of overwork in nursing students by type. This is study method. To identify subjective perception on death of overwork among nursing school students, this study uses Q methodology. The Q population was derived through a review of domestic and foreign literature, open questionnaire, and individual in-depth interviews to extract comprehensive statements on the effect of death or of overwork, centering on current enrolled nursing students. Through this process, more than 150 Q population are derived, and total of 80 Q populations are derived by integrating documents collected through a review of domestic and foreign related documents. Through review and revision of statements, this study could finally get highly discriminable 34 statements. This is sampling method. As the p-sample, this study selected total 14 nursing students who voluntarily agreed to participate in this study after fully explaining the objectivities of this study to them. This slide shows Q classification process and method. 14 nursing students, the time for each participant to complete Q classification was from 35 to 50 minutes on average. Data analysis was performed via corner PC program, and Q factor analysis utilized principal components factor analysis. The mean and the standard deviation of components were analyzed utilizing SPSS program. This is result. As a result of analyzing subjectivity toward death of overwork using the PC corner program, it appeared as two factors as explained. 52.98% of the total variance. Factor 1 was 19.47% and factor 2 was 12.98%. Since factor 1 has 19.47% explanatory power, it can be seen as the factor that most explains death of overwork. Of the total 14 survey subjects, 8 were found to belong to factor 1 and 6 were found to belong to factor 2. Those who fall into each factor refer to groups with similar responses to death of overwork. The type of subjectivity toward death of overwork calculated by this type analysis method is as follows. The first type is death of overwork reduction plan centered type. As for characteristics of type 1, they thought that the average working hour in Korea were wrong and that death of overwork was high because there were many cases of mental health disorders such as stress while working. Therefore, they thought that in order to reduce the number of deaths from overwork, it is necessary to have industrial managers in the workplace and monitor work periodically to prevent death due to overwork, and measures such as reduction of working hour will be needed. However, they said that it would be insufficient to reduce death of overwork only with current death of overwork prevention measures and investigation. They also stated that shift work, according to the characteristic of individual occupations or individual efforts, would not help to prevent death of overwork. Therefore, Type 1 was named Death of Overwork Reduction Plan Centered Type. Type 2 was named Nurse-Centered Cognition Type. The characteristics of Type 2 is that they believe death of overwork is an industrial accident, and they think that measures to prevent death of overwork are needed to reduce the number of deaths from work. They argued that late night work and shift work would increase the risk of death of overwork. However, they disagreed with the opinion that the problem of death of work was a problem specific to specific occupation, and they did not believe that specific disease was the cause of death of overwork. They think that death of overwork is caused by all the causes such as overall social perception of work and mental stress as well as the body. In addition, they recognize the death of overwork in consideration of their position as future nurses and their position as a target. Therefore, the Type 2 was named Nurse-Centered Cognition Type. This is discussion. As the result of this study, the type of subjectivity toward the death of overwork recognized by nursing students were identified as Type 1 death of overwork reduction plan centered type and Type 2 nurse-centered recognition type, and accordingly the characteristics of each type will be discussed. In this study, Type 1 was medical personnel centered perception type. Perceived nurses, they thought the measures for perceiving solved medical disputes nurses. The Type 2 was nurse-centered recognition type. Students entering the Department of Nursing enrolled with clear hope of becoming nurses in the future. Accordingly, while studying in the nursing department, they think and judge many things from the position of nursing. This perception seems to have been reflected in this type as well. They thought that death of overwork is an industrial accident, and nurses' work characteristics such as late night work, shift work, long work hours, and extreme stress could be the cause of death of overwork. This research on subjectivity will help to transform the perception of death of overwork in our society. In addition, by suggesting the structures of subjectivity, perception of death of overwork among nursing school students, and characteristics of different types, it is hoped that such findings will be used in basic sources in developing differentiated educational programs. However, there is a limitation in generalizing the research result because the study was conducted on single university and the subjects could not be selected in consideration of factors affecting the perception of death of overwork, and further variation of the type is needed by constructing Q sample with various background through follow-up studies. This is conclusion. This study was attempted by applying the Q methodology to prepare basic data necessary to suggest change in the perception of death of overwork and the directions of approach by nurses through subjective data resulting from exploring and analyzing the subjectivity perception of nursing students on death of overwork. As a result of this study, it is classified into two factors: the types of death of overwork recognized by nursing students were death of overwork reduction plan centered type and nurses centered recognition type. This study typifies subjectivity toward the death of overwork among nursing students and provided the basic data to prepare ways to improve attitudes and perception of death of overwork in the future. Since this study analyzed and identified the type of recognition of death of overwork among nursing students, it is expected that an educational program that considers the characteristics of each type will be developed. In addition, a qualitative study is proposed to identify various factors influencing the recognition of subjects of death of overwork, and additional research on type analysis by subjecting samples considering various factors. This is references. That's it. Thank you very much for your attention. Now, I'd like to open it up for question. If you have any question, please raise your hands.